I'm Dr. Peter Derman, minimally invasive and endoscopic spine surgeon. October is Spine Health Awareness Month, and I'm here at the Texas Back Institute Physical Therapy Department to talk about core strengthening and stabilization. How does core directly affect spine health and stability? The core muscles, which are not just the abs, but the muscles in your flanks and your back, create like an internal back brace that helps hold you up and stabilize the spine. And so keeping these muscles strong creates a good, stable core for your low back and can help take some of the pressure off of the discs and the joints and the nerves of the low back. Can a weak core contribute to spinal issues such as disc problems and low back pain? The answer is absolutely. While low back pain frequently comes from a variety of sources, having a weak core is definitely one of them that can predispose patients to having back issues. And so it's really important to optimize the core strength to support the spine. What types of exercises do I recommend to strengthen the spine? There are a variety of different sites in the spine that can cause pain, and the exact exercises and stretches that need to be done to address those areas depends on where the pain's coming from. However, in general, I prefer isometric type strengthening exercises for the spine. These involve things like planks, side planks, and bridges on the back. And those are usually pretty safe exercises for anyone to do. But certainly if you're having spine-related pain, it's worth seeing a physical therapist to have a direct consultation evaluation and then learn the exact specific exercises that are necessary to treat your exact problem. Are there any exercises that should be avoided? Actually, the most common thing that I think comes to people's minds when they think about core strengthening is crunches. I actually don't like crunches. Crunches do exactly what they say, crunch. So every time you do a crunch, you're crunch, 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 putting pressure on the discs of the spine. And that's why I really prefer the isometric type exercises that hold your core in a fixed position while strengthening the muscles around it. How should someone with a sedentary lifestyle or weak core start? Like anything else, it's important to start slowly and work your way up. If you do too much too soon, you can certainly exacerbate your pain or pull a muscle. I think that starting with some of these isometric type exercises, maybe visiting with a physical therapist who can gradually ramp up your activity level is a nice way to increase your core strength and hopefully either treat or prevent future back issues. Is age a consideration in core strength exercises? Certainly it's important for everyone, no matter how old or young, to have a strong core. But the sources of back-related pain do tend to change over time. So young people more frequently have disc-related pain, while older patients frequently have arthritis in the joints in the back of the spine. And the exercises that should be done in order to treat those various sources of pain differ by the source of pain. And so I do think that while isometric type exercises are probably safe for everyone, the more patient-specific exercises often do depend on a patient's age. And again, this is where it can be helpful to involve the skills of an expert.